接着是来自菲律宾的那巴洛医师。那巴洛医师是菲律宾慈济眼科中心院长，他是一位天主教徒。2007年开始参加义诊，2000年第一次来台湾参加 TIMA， 参与后感动满满。上人对他而言是生命的导师，遇见上人与慈济，让他的生命中有更深层的意义。疾病无情，人医有爱，在疫情如此严峻之下，如何维持让慈济眼科中心持续运作，让爱持续循环？现在，让我们一起来聆听那巴洛医师的分享。
Good day to our beloved Master Cheng Yen and to all our brothers and sisters in the Chu Chi world. I am Dr. Bernardita Navarro, currently serving as the medical director of the Chu Chi Eye Center in the Philippines. At the height of the COVID-19 pandemic, the Chu Chi Eye Center was among the few eye care facilities in the Philippines that accommodated patients. We got a lot of raised eyebrows from the people who have been asking us if we were not scared to get the disease. The truth is, we were terrified. When the government imposed a total lockdown on March 15, 2020, we immediately closed the eye center. Just like everybody else, we had our apprehension because we did not know what would happen next. On the news, we watched our countrymen who lost their jobs because of the health crisis. With limited, if not zero, income, families relied on government aid for food. But the most difficult part was hearing news of friends and colleagues who succumbed to this disease, which has at that time no known cause and cure. It could easily make one feel helpless and even scared. But the call to serve is stronger than anything for a volunteer physician. So after careful planning and preparations, we reopened the eye center on June of 2020, but with strict compliance to the health protocols. Initially, we planned to attend only to patients who needed the most urgent care. This include the post-operative follow-up and emergency surgeries for glaucoma and retina cases. As days passed, more and more people came knocking at our doors because of the bilateral cataracts. The pandemic has occupied all the hands and rooms of public and private hospitals, so that non-COVID patients, including with cataracts, had nowhere to go. That was when we found ourselves at the crossroads. If we start accommodating patients for consultation, we risk spreading the infection or getting it. But if we did not choose to do so, these patients could go blind. As ophthalmologists, this was one of the most difficult decisions we had to make. But then, almost every day, people sent us boxes of personal protective equipment and alcohol. There was an acute shortage of those supplies in the country at that time, but we have received donations from various individuals, groups, and even strangers who offered to support us without expecting any recognition. This generosity and kindness from our fellow volunteers and even complete strangers overpowered our hesitation and fear. Knowing that we were not alone in this mission emboldened us. So the Chu Chi Eye Center began to offer free consultations again to a limited number of patients every week. Our surgical services also continued. Although the experience in the past 2 years have been traumatic when we hear stories of our patients who used to be blind, we were happy that we have restored a lot of their sight after surgery. In our volunteers' hearts and minds, the little comfort that we can offer to our patients who are already in great despair makes them feel that the world is not short on love and care. One of the patients that we were able to help was named Randy Protasio. Randy lost his father when he was only 3 years old. His father died after a vehicular accident. In 2006, his mother died of cardiac arrest. He was left to the care of her Aunt Celia. They lived in the streets of Avenida, Manila, because the children of Aunt Celia would only accept her in their home, but not Randy. So each time her children would ask her to stay with them, Celia would refuse. She said she could not bear thinking that his nephew, Randy, would stay alone in the street. He is deaf and mute. She promised Randy's mother that she would take care of his son. So despite of Celia's advancing age, she tried to keep her vow. Despite the disability of Randy, he is quite street smart. If he earns money, he would lend his money to his cousins to buy. Randy helped himself by assisting other jeepney drivers, selling candies and snacks, and even doing errands for a nearby funeral parlor. Despite being unable to hear and speak, Randy was full of vigor. Then, when the cataracts developed in his eyes, it left him blind. It was then that Aunt Celia became the eyes and the ears of Randy. When they traveled together, they would lose their balance. In one instance, Celia tried to borrow a wheelchair so he could bring Randy to different hospitals and centers. But she did not anticipate is it would be very hard for her to push her nephew on a steeper bridge near the hospital. Celia was so determined to have her nephew treated. Despite of all her efforts, none of the hospital's doctors were able to perform Randy's needed surgical procedure. They cannot afford the enormous sum of money prior to the procedure. Disappointed, Celia would take her nephew back to Avenida Street again. One day, a stranger in one of the hospitals they visited advised Celia to visit the Chuchi Eye Center. That was how we met Celia and Randy in early 2021. It was a challenge to treat Randy because he cannot see, he could not see and hear, and he failed to understand what was happening around him. When placed in a bright light of the street lamp, he wouldn't open his eye. It became clear that Randy needed to undergo surgery, but that surgery had to be performed while he is asleep. The medical team considered doing the surgery at the hospital. However, COVID-19 made it difficult to secure an operating room permit, and putting off the surgery on one more day may result in further complications. Luckily, our team of volunteer anesthesiologists by the name of Dr. Larry King agreed to help. With him on board, it became possible to perform the removal of Randy's cataract at the Chuchi Eye Center. Putting Randy to sleep also is not easy. He refused to lie down on the operating bed. The surgical team had to call his aunt to talk to him, and Celia suggested playing some music. It turned out that though he could only hear faint notes, Randy is fond of music. One of the nurses played a song next to his ears. Dr. Larry and others worked on giving him the anesthesia. Eventually, Randy fell asleep while he was seated. The surgical team then gently put him flat in bed, and they were able to start the procedure without a hit. After Randy's eyes became free of cataract, Celia was so relieved. In one of his post-surgery checkups, Randy approached the photo of the master, Cheng Yan, hanging in our lobby and putting his palms together in a prayer position. With a vow, we understood that it is his way of thanking Chuchi. At that moment, no human ear can hear his gratitude. But every one of us in the eye center felt his sincerity. Beyond holding our clinics, the volunteers are also actively participating in the COVID-19 vaccination rollout. We did this when our medical and non-medical personnel has already completed their primary vaccine. The office of the Quezon City Mayor sought the help of the Chuchi Eye Center in their vaccination drive. We invited our volunteer doctors and nurses from various healthcare institutions to join us, and we were overwhelmed with their eagerness to help. A lot of them to celebrate their birthdays with us. One volunteer dentist who usually spent her birthday by having a vacation abroad decided to stay in the country and help in the vaccination drive. She said that she could not leave the country and enjoy while seeing the long lines of people waiting for their turn to be vaccinated. Indeed, as Master Cheng Yen says, when we make great vows and put them into action, we realize our true virtues. All of us were aware of the risks involved in the participation in the vaccination. In the back of our minds, we said, who else can we count on to safeguard the people's health? Tzu Chi has to help. Master Cheng Yen's words were also in our hearts and mind. She said that success is achieved by seizing the moment and accepting its challenges. To date, we have helped in 45 of the city's government vaccination drives and have administered 116,000 vaccine shots. We did not stop after the primary vaccine. To this day, we are also part of the booster shot rollout. It's not all work. During the vaccination drive, we found time to celebrate many of our volunteers' birthdays and even greet the Master during the Chinese New Year. One would think that doing good should come easy, but it turned out to be one of the most difficult things to do. Despite our good intentions to do charitable works during the pandemic, we still met tons of challenges, but we could not complain. After all, nobody has asked us to do these things. We offered it unconditionally and willingly. We wanted to help our countrymen and earn their goodwill. With this, we received a plaque of appreciation from the office of the Quezon City Mayor herself. Receiving the plaque, we were reminded of the aphorism, good relations with others come from giving selflessly and earning the fondness, trust, and admiration of others. We are always thankful to Master Cheng Yen. Her great love and her reputation earned us the people's trust. Ultimately, we are thankful to the Quezon City government and to all our patients at the Tzu Chi Eye Center for giving us the opportunity to serve in these uncertain times. Master Cheng Yen also said, a committed person will transform pressure into a mission and thus tap into an inexhaustible well of joy and energy. During the COVID-19 pandemic, the world may have stopped, but the team of volunteers in the Philippines made sure that our love goes round and round.